Ancient Roman poet Virgil very rightly said, "Health is the greatest wealth." But did you know that there exists a small fraction of people in this world who desire to be disabled? So intense is their desire that some may even undergo voluntary amputations or try making themselves blind or deaf in a bid to fulfill this desire. Such people are said to be suffering from body integrity identity disorder. While the Greek myth says that King Oedipus blinded himself as a result of the remorse he was feeling for his past actions, the desire for people with body integrity identity disorder to become disabled stems from a medical condition rather than guilt. Keep on watching to find out more about this rare but interesting medical condition. So what exactly is body integrity identity disorder? Body integrity identity disorder, or BIID, also known as body integrity dysphoria, amputee identity disorder, and xenomelia, is a disorder characterized by a desire to be disabled or simply being uncomfortable with being able-bodied. This desire arises due to a mismatch between one's ideal body image and the actual physical appearance. As a result, victims of BIID believe a part of their body does not belong to them. This belief often leads to their desire to amputate the offending limb, which is healthy and working properly, or to become blind or deaf. BIID is kind of similar to gender dysphoria. While in gender dysphoria one wishes for a change of gender, those with BIID wish to exchange their normal body with an incomplete one. People with BIID often refer to themselves as transabled, just like how people with gender dysphoria refer to themselves as transgender. Apart from the intense desire to lose a limb or a sense, such as sight or hearing, people suffering from body integrity identity disorder often feel anxious and depressed. The anxiety and depression are generally due to the discomfort caused by being able-bodied. Although it may seem that BIID is a psychological condition, it is a neurological condition. As this condition is an extremely rare disease, there isn't much research available, and a definite cause for it hasn't been identified yet. The most popular theory for the cause of BIID is the cognitive mismapping theory. This is the sensory cortex of the parietal lobe of the brain. It has specialized areas to detect somatosensory information coming from the legs, hands, and parts of the face. For example, when you touch your leg, the leg area of this brain map will stimulate and create the experience of sensation. The technical term for this sensory map is the sensory homunculus. It is assumed that in people with BIID, map areas corresponding to the offending limb are impaired or mismapped, as a result of which the brain sees the offending limb as being foreign and not a part of the person, hence the desire to have it removed. Research has also shown that those desiring amputations have brain damage in the right hemisphere of the brain around the somatosensory cortex. Some other plausible risks for BIID put forward by researchers are childhood trauma, obsessive-compulsive tendencies, exposure to amputees at a young age. The wish to become an amputee or to become deaf or blind begins at a very young age and usually begins between the ages of 8 and 12, although they seek treatment when they are much older. So, how do we treat BIID? Sadly, there is no cure for this condition. Most doctors prescribe cognitive behavioral therapy and antidepressants, intending to reduce the anxiety, distress, and depression caused by living with BIID. Treating the symptoms of obsessions and compulsions has also been proven to be successful in reducing symptoms of BIID. Even after years of psychotherapy, some people still wish to be disabled. Some may act out their desires by pretending that they are amputees using prostheses and other tools like canes, in the hopes of easing their desire to be one. Some even resort to self-amputation, while some damage the limb sufficiently that amputation becomes necessary. However, the latter two are extremely rare. While the obvious and most logical treatment for BIID may seem like to make the patient disabled, this is not done for many reasons. Amputations have only been shown to have a 70% success rate of resolving the symptoms of BIID. The ethical concerns relating to amputating a healthy limb. An interesting fact is that most victims of BIID are males, with an association with gender identity disorder and certain personality disorders like borderline personality disorder. There also doesn't seem to be a preferred site for the unwanted limb or any history of trauma to the unwanted limb among the prevalent cases. BIID, or the desire to be disabled, is a very real medical condition, causing great distress to its victims. I'm a doctor making animations about interesting medical cases. Don't forget to leave feedback in the comment section. Thank you, take care.